Hey folks, this is Denny from TheraThink, and today we're going to talk about what TheraThink can do for you within your private practice with our billing service. So let's begin. We commonly get inquiries from folks who are going through a billing nightmare. They get on the phone with insurance companies and wait on hold for 20 minutes, dealing with rude operators who provide half-baked information, and oftentimes they're rushing to get started with their next session, frustrated that they haven't been able to actually find the information they wanted in the first place. After going through an unfocused session with frustration, you finally get on the phone and wait 40 minutes or so, and you're able to actually get the information you need for that client. Afterwards, you actually need to file your claims. You print out a CMS 1500 form, filled in by hand, and perhaps you fudge a couple of the fields. You're unsure about the coding you should use, which frankly doesn't feel very good, not knowing exactly the diagnosis and CPT code for your patients. And then you go and send it off to the insurance company, and you wait and you wait and you wait. After enough time with nothing back from the insurance company in the mail, you finally call, and you guessed it, they never received the claim. And this happens on and on and on with our clients, and that's one of the reasons why they come to us. But don't worry, we can help. So here's the picture of life with our service there, I think. You log onto your email, and you see that the new client's information that you requested from us is there, ready to go. In between sessions, you just take 5 or 15 minutes to log into our system to add your appointments for the week. And really, that's it. It's really that simple. We make it as simple as possible for you to be able to use our system that's dedicated specifically for non-technical mental health therapists. And the thing is that you're not a billing expert. You're a trained and dedicated therapist. So let us handle the phone call burden of billing, and let us take your appointments to full payment for every session. So quickly, how does our whole system work? It begins with setting up your actual dashboard, and that really just means registering your information as a provider, the existing clients that you have, and if you do have any claims that have yet to be filed or have been denied, you can go ahead and add them in as well, and we'll try to take care of them for you. Then, whenever you receive a new patient inquiry, you just send over the information to us, or you just tell the patient to log onto our system and add it themselves, and we go ahead and verify their eligibility and benefits for you. And then once you've seen that client, you go ahead and add the appointment date to the calendar, which takes just seconds, and you're off. And really, that's it. Afterwards, you're just going to receive payment directly to you, and we can generate statements for your clients and yourself every month. And it's really that simple. So we often get asked, how much does our service cost? And many services have hourly rates where they'll say this is going to take this much time per hour, or they'll charge high monthly fees, etc. We pride ourselves on our ability to close claims and get you paid in full. And as a result, our pricing reflects that. So our pricing model is a percentage-based model. It's dependent on the collected revenue that you receive for the claims that you get. So if you don't get paid for a claim, we don't get paid. Again, we don't charge you hourly rates. We don't charge you monthly fees. It's just if you've received successful payment because of our services, then we charge you for that. And what it means is that we're on the same team and we're both invested in each other's mutual success. So if you want right now, I strongly encourage you to go ahead and give us a phone call. We're at 206-923-8954. That's a Seattle number. We're a Seattle-based startup, but you can go ahead and call, and we serve everyone in the United States, so don't worry about that. And again, we're a group of seasoned medical billers and technology experts who are dedicated specifically to helping mental health therapists only. So our system is built specifically for non-technical behavioral health specialists looking to quickly offload their billing headache. And literally, people ask me on the phone, okay, well, what's the hidden catch? What's the downside? What am I missing? And there isn't any catch. It's really as simple as that. we use economies of scale to be able to handle a lot of these things in mass, to be able to do it more effectively than you ever could. And that's why, as a service, we're not only affordable, but we're also reliable, because we do this for many clients. We've gone through every single possible issue that you could imagine. So if you're a licensed mental health therapist anywhere in the United States, we're happy to help. Go ahead and give us a call. And again, you can do so by calling 206-923-8954. I know that some people get hesitant to call because they feel like, oh, I'm just going to be try to get convinced, or a sales rep is going to call me, blah, blah. If you call, you'll speak directly to me or one of our team members. We don't have any sort of hard selling. We just let you know what we do, walk through this basic process with you, and learn a little bit more about your practice. You can also email us, learn more at therathink.com. That's another way. But we do require getting on the phone to make sure that we have a good fit. We treat our relationships as relationships, and so we need to feel comfortable working with each other, because it ends up being usually a long-term commitment. Some questions that we often get asked: do I need to be good with technology? I don't want to learn how to use a whole bunch of tools and systems when I can do it on my own, even though it's really time intensive. And the answer is absolutely not. We made sure to build our product specifically for technophobic folks who do feel like, oh, I really don't want to learn about this stuff. So you would need to use a web browser. You need to be able to type, but that's basically as much as you need to know. And it's not just a piece of software. It's an interface that lets you correspond with us effectively. But we actually do the manual process of calling up insurance companies for you to pre-verify your clients, calling up insurance companies to check on your payments and EOBs, and handling any denials and any appeals for you as well. So we really do take you from appointment to full payment. Another question we get is, how often do I have to add appointments? I don't want to add appointments every day. I don't want to have to spend a whole bunch of time doing this, especially if I'm hiring a service to do it for me. And the answer is that you get to set your schedule. So if you want to log into our system every 2 weeks, great. The only caveat there is just that because insurance companies require timely billing, we do require that you log in and use our system for claims within 90 days of the appointment date. And really, it should be much, much, much more regular than that. So every 2 weeks, it takes about 20 minutes max, and you'll be able to be on your way. Does your location and license matter? As long as you're a licensed mental health therapist and you're on insurance panels, you're set. And then if you have any other questions, really don't hesitate to call us or shoot us an email. We're happy to help. And we're happy to just lend some advice too, if you do need some advice. So whatever we can do to help you folks out and build our brand and build our reputation, we're excited to do. So again, you can reach us at 206-923-8954, or you can email us, learn more at therathink.com. Just quickly, some other things. We are ICD-9, ICD-10 compliant. We're HIPAA compliant. We secure all of our data using high-level encryption. We file claims every day, so you don't need to worry about how timely the claims will be filed. We do new eligibility claim checks 3 times a week, so you receive the actual information within 48 hours or 2 business days. And we also handle any sort of deductible updates, so we check the deductibles for your clients every year. We also generate monthly statements for you. You can log into your client panel to see active denials, active claims, and paid claims by client. And the benefits of this is that we get to reduce your revenue cycle by using online billing, so that you're getting paid much more quickly than you would if you were to file claims with paper. And if there are any issues with denials or appeals, we take care of it for you. So, really, we'd love to hear from you. It doesn't mean we're gonna necessarily work together, but if we can help you out in some way, that'd be great. So go ahead and call us, 206-923-8954, or shoot us an email. And we'd love to at least learn a little bit more about your practice and see if we'd be a good fit. So shoot us a call and talk to you guys soon. Cheers.